Welcome to the Muscle Expert Podcast with Ben Pakulski, one of the world's top professional bodybuilders, an expert on human performance and mindset mastery. Ben dives deep to deliver the strategies of the top experts to upgrade your body, mind, muscle, strength, performance, biochemistry, and how to become the upgraded modern man.
So we're sitting here in Lake Tahoe, and I'm sitting beside a very brilliant gentleman who is going to tell us a lot about gut health. And I've had the amazing pleasure to be able to chat with Dr. Mike Ruscio for the last 48 or 24 hours and get to know you a little bit. And I love your conversation around your intake process, Mike. So you said, I asked you a little bit about testing, and we started talking about your, someone walks into your office and we say, I have these symptoms potentially. How do you first go about diagnosing potential gut implications? Like what are the signs and symptoms that people should be looking for to determine whether or not they are actually experiencing some gut issues?
Well, I mean, there's some pretty obvious ones that most people would be able to connect. If you have constipation, if you have diarrhea, or if you just kind of have this irritable bowel where sometimes you're constipated, sometimes you have diarrhea, sometimes you're normal, and you keep kind of oscillating between those three. If you have abdominal bloating, pain, reflux, I mean, those are all pretty dead giveaways, but the thing that I think is more interesting and really exciting that we're learning in the research and actually seeing pretty high-level scientific documentation connecting these things is someone can have silent gut inflammation that only manifests as joint pain, as brain fog, as insomnia, as skin eruptions of various sorts. And that's what makes that's both the gift and the curse, right? The cool thing is that someone could come in with joint pain, chronic joint pain, and the solution could be found in their gut. The challenge is we can't just use gut symptoms to potentially diagnose or suggest that they have a problem in the gut. So what I like to do is look at it more as an algorithm where we'll start off with your basics. Cut out processed food, cut out some of your typical inflammatory foods. Maybe you try a paleo diet or a Mediterranean diet, some movement toward a healthier diet. I don't think it's incredibly important which, although some might argue that point. And let's make sure you're getting enough sleep, you're not overtraining, you're not undertraining, you're managing stress, some of those foundational pillars. Let's get those in place. And then once those are in place, reassess, meaning do you feel like your problems are gone? And if they are, great, we're done. But if not, let's make the next thing that we do going through a process of trying to optimize your gut health.
From your experience, is there like one or two of these main lifestyle interventions or lifestyle factors that tend to contribute most to GI distress and inflammation? Well,
and we were talking about this yesterday. One of the interesting things is that sometimes a high intake of vegetables is actually what is problematic for people. Yeah. And this took me forever to come to grips with because I came from kind of a bodybuilding background, and we didn't even actually talk about this. Two of my cousins were the Power Company twins who were wrestlers in the WCW, and when I was young and wanting to put on some muscle, I turned to them, and so I got pulled into the bodybuilding culture, and so for me, lots of vegetables was kind of a key thing depending on kind of like the phase of your training that you were in. And then obviously you go farther forward into health research, and almost every dietary camp harps on the importance of vegetables, right? No one is there's debate over carbs and fats and protein, but no one ever says don't eat vegetables.
Except for the carnivore camp. And there's actually some people.
Fair point. Yeah. So I guess up until just very recently, no one has really bashed vegetables. Mm-hmm. However, we've definitely learned, and I think the low FODMAP diet research is one of the best, or also maybe the low flex diet has documented this, but for some people, too high of a vegetable intake can really be problematic for their gut.
Can you describe what the FODMAP diet
sure.
is? And the other one you said, I don't even know.
So the low FODMAP diet is probably the most salient for the audience. And the low FODMAP diet essentially, and it stands for low fermentable oligo, mono, disaccharides, and polyols. And what does that translate to? It's just certain forms of carbohydrates that we can't really digest, but bacteria can. And so they end up feeding bacteria. Because this is the stuff that we can't absorb and hangs out in our gut, and the bacteria can. Now, that can be a good thing, right? Because you feed these intestinal bacteria, which are symbiotic and have these health benefits for us. However, for some people, they have this predilection toward those bacteria overgrowing, or they may be hypersensitive to the gases that those bacteria produce. Just like a car metabolizes fuel, lets out gas from the tailpipe, bacteria also let out gas as part of their metabolism. And so some vegetables, not all, but some, are very rich in these FODMAPs, or these compounds that feed bacteria and produce gas. So if you're high in bacteria, or if you're sensitive to gas pressure and you're eating a high FODMAP diet, you're really kind of exacerbating that problem. So broccoli, asparagus, avocado, cauliflower, a lot of these foods that we would say are very healthy may be problematic for certain people. And one thing people can do as a short, literally in 2 weeks, you can get an initial assessment of, is this working or is this not working, is just go on a low FODMAP diet trial, and that may resolve many cases of bloating, gut pain, indigestion, diarrhea, constipation. And so that's one simple thing that sometimes people have a very hard time connecting the dots with. So giving the low FODMAP diet, great idea. The low flex diet was more so, as I understand the background of it, it stands for low fat and fiber, essentially, is what this diet does. And this was pioneered more so for people with inflammatory bowel disease. And so it lowers fiber. Some people with sensitive guts have probably put together, man, I can have rice with no problem, but if I have broccoli, it really irritates my gut. Well, you're not alone in that observation. And so the low flex diet decreases dietary fiber while also decreasing dietary fat. And too much fat can also aggravate one's gut. That's much less often used. I wouldn't recommend people necessarily go out and try that one. I think you'll get most of the yardage that you need out of the low FODMAP diet. Unless maybe someone listening to this has inflammatory bowel disease of some type and wants to try low flex, they could look it up on the internet and give it a try.
What are some of the simple dietary approaches you take? Because people are getting thrown so much information on this stuff. It's eliminate basically everything and don't eat anything. So maybe it's best to work backwards. What are some of the foods that you do recommend people stick with? Is that how you work? Is you have a certain number of foods that are kind of your core foundational foods, or do you try to eat a vast array of foods and just be aware? Because if you tell someone low flex diet, low FODMAPs, you can't eat gluten, you can't eat dairy, you can't eat, everyone's okay, well, what's left?
Right. No, it's a great point. And the way I look at diets is, we have kind of a handful of diets on the board, and we just want to try to find a way of helping an individual realize what diet is best for them. And it's not to say that one diet is better than another, but some people will do better lower carb, some people will do better higher carb, some people will do better if they have some grains in their diet, other people will really do better if they don't have grains. And it's not that complicated of a process. What you just want to do is try a couple different dietary trials in sequence, and you'll learn something from each 2 to 3 week clip. And so the two best starting points, I think, to help someone figure out what foods work for them and what foods don't work for them, because the core of, are there some safe foods that are safe for everyone? It really does vary from person to person, but it's also not that complicated to figure out what works for you and what may not work for you. I would first start with a paleo type diet. It doesn't have to be 100% ardent, strict paleo, but reduce or eliminate grains, gluten, dairy, soy, processed foods. Focus on healthy meats, vegetables, fruits, nuts and seeds, fats, and give that a few weeks. And for some people, that's all you need to do, and they're feeling great. And there's a few programs out there. Whole30 has an iteration of the paleo diet. I know Rob Wolf's got one. There's a litany of, you can go on the internet and just type in paleo food list and have something in 2 seconds. And see how you do with that. Now, if not, you could then modify that and go on a low FODMAP diet. So this is going to give you a different approach, right? So the first experiment you're running, you're asking your gut and your gut and your immune system, do we do well when we cut out grains and processed foods and a lot of these things? But you may also, at the same time, when you go on a paleo diet, end up increasing your vegetable intake. And so if you're really FODMAP sensitive, that may not work well for you. So that's why I recommend kind of that 1-2 stagger approach. Start with paleo, and then if paleo doesn't fully resolve the issue, consider a trial on low FODMAP. And in my book, we talk about a paleo, we put together paleo and low FODMAP. So if someone did well on paleo, but they didn't feel fully improved, then we can carry forward some of the paleo principles, loosen the boundaries a little bit to make some room for the low FODMAP restrictions, and then do this union of called paleo low FODMAP. And again, it's not that hard. What you're looking at is, here's food list 1, follow that for like 2 to 3 weeks, then reevaluate, then move over to food list 2, follow that for 2 to 3 weeks. All along the way, you're learning what works and what doesn't work. And that, you can get a lot of yardage out of that from a dietary perspective. Of course, if you're trying to optimize for performance, then macros and things like that come into play. But I would argue that first, you've got to be able to tolerate the stuff you're trying to get into the system. So first, we want to go through this exercise of figuring out what foods work, what foods don't work, and then later you can dial in your macros.
For someone looking to recover from any type of inflammatory GI ailment, other than dietary interventions, like, hey, we know you need to fix your diet, where do you begin with, we have athletes who are experiencing bloating, they're experiencing indigestion, they're experiencing diarrhea, constipation, brain fog, and joint stuff. Right. Depending on somebody's symptom, do you recommend a different intervention to begin, secondary to the diet? We've already fixed the diet, we've eliminated all the FODMAPs. Now where are we going? Or does it have to be an individual thing, or does it go symptom by symptom? Do you see trends?
Well, not so much symptom by symptom, because the symptoms can be so nonspecific, right? And so I try to think of it more from the perspective of working through like a systems diagnostic approach, right? Like, what is the most dysfunctional system, and then what is the second most dysfunctional, like within the gut, right? Or said more technically, what therapeutic approach will help the most people,
right,
and then what will help the second most people, what will help the third most people, and you kind of work through in that algorithmic approach. Again, one thing, and I have a specific there for you, but one thing I just want to backstep to really quick is meal frequency is also important. And I find in the athlete community, there tends to be a lot of calorie intake and therefore a lot of meals. And for some athletes, just adopting a practice of intermittent fasting of one sort or another, which again doesn't have to be super complicated. For some people, that just means you skip one meal 2 to 3 days per week. So you skip breakfast 2 to 3 days per week. You give your gut a few hours off in the morning, and then you have lunch and dinner. Or for some people, they may do a 24-hour fast 1 day a week, where they may fast. And some religions do this, right? They fast every Sunday, as an example, and so they eat dinner on Saturday night, and they don't eat again until Sunday night, kind of thing. And that can be a nice chance to give your gut a break. And so I just don't want to gloss over that, because sometimes, we can fix a problem with doing less rather than doing more, right? Yeah. So I would definitely tinker with a little bit of meal frequency to see if that's something that may give you a therapeutic gain. And then the next thing someone can do, if the diet's not fully helping them, a well-constructed probiotic protocol, you can really get a lot out of it. The challenge, I think, is that people are inundated with so many different probiotic products that they can't make heads or tails of what to take and what not to take. Some of the probiotics are also imbued in a kind of base that's fairly high in prebiotic. And just like the high FODMAP diet is high in prebiotics, it's high in feeding bacteria. Well, you can run into the same problem if you give someone with a sensitive gut lots of prebiotics in their probiotic. So in the book, I also talk about there's a 3-category system. When you look at the research on probiotics, you can really classify probiotics into technically 4 categories, but one of these categories you can't buy in the U.S., so I just say 3 categories for ease of conversation. And those 3 categories are a lactobacillus bifidobacterium predominated blend. So you look on the label, you'll see lactobacillus acidophilus, bifidobacterium infantis, and you'll see maybe 7 to 15 different strains that are all starting with lactobacillus or bifidobacterium. So that's your category 1. Category 2 is a Saccharomyces boulardii, which is actually a fungus. And there's some very compelling research also with this strain, as there is for category 1. And then category 3, probably the least studied, but it doesn't mean that it's the least effective. It's just the least studied. There's, I think, 14 clinical trials to date, whereas with a category 1, I think there's about 90. But again, it doesn't mean one is better than the other. It's just the Lactobacillus bifidobacterium probiotics have been known for longer, so there's been more research published on them, whereas the category 3 probiotics, which are also known as your soil-based or your spore-forming, they're sometimes known as, and they have the bacillus strains in them, so Bacillus coagulans, Bacillus subtilis, Bacillus licheniformis, you may see on the label. And that's your category 3, about 14 clinical trials in those, and those can also be helpful. Now, why this is important is because not every probiotic will be a good fit for every gut, right? So there are some people who feel notable improvements in their bloating and their abdominal pain if they take, just as an arbitrary example, a category 1, and they also feel that benefit from a category 3, so they take them both, and that really sits well with their system. But if they take a category 2, they feel like they get a little bit constipated. So the challenge is, if you're taking a probiotic formula that has all of these in one, and you're having a reaction, you can't parse out where the reaction is coming from. So you could do it with everything in one, but to personalize the probiotic stimulus to your gut, I think it's better to break them down into different formulas. And another simple experiment you can go through, add in. So there's 2 ways you can do it. You can do it from like the top down or the bottom up, meaning you can add all 3 in and then see how you do, or you can add them in one at a time. If you're someone who's sensitive and reactive, I would say add them in one at a time. Because if you have a history of reactivity, there's a decent probability that you will react, so you want to be able to pinpoint that. If you're not historically reactive, then you can add all 3 at once. But within a few weeks, you can get a sense, yes, this one works, this one maybe doesn't work. And then, boom, you've personalized your probiotic protocol, and probiotics can help to fight dysbiosis, meaning imbalances in fungus and bacteria. They can help with leaky gut. They can help with inflammation. They can help with immune function. So there's a lot that probiotics can do. And I think because we've heard so much about probiotics for so long, people kind of gloss over them. Unfortunately, when it comes to recommendations to improve gut health. But if they're used the right way, you can literally see someone who had lab work positive for a yeast overgrowth and a bacterial overgrowth, and all you have to do is give them a probiotic, their lab work clears up and their symptoms go away.
Can you help us differentiate between a microbiome issue or dysbiosis and a leaky gut and what the symptoms may be? Because sometimes people group those together, and I think it should be. It sounds like there's a pretty clear distinction.
Yeah, it's a great question, and there's some tricky points here for the consumer really to be wary of. There's a lot of tests, right? And maybe not a lot, maybe a lot's too high of a number, but there's a number of tests now that are marketing direct to consumer that map your microbiome. And we should create a distinction, which is there are tests that have been classically used to identify pathogens and clinically documented imbalances. So small intestinal bacterial overgrowth, or SIBO, there's a whole breadth of literature validating that test, correlating that test to IBS symptoms, and then showing that when we treat the overgrowth, the symptoms improve, and that correlates with an improvement in the lab, right? So that's a validated test. That's something that can be clinically useful, validated test. Same thing for something like a stool test or other methods of assessing H. pylori, right? We can do testing pre-post that tends to correlate with the outcome of the patient. So these are tests that have clinical utility and that have a clinical track record and have clinical validation. The microbiota mapping tests that kind of give you a readout of all the bacteria, or even take the bacteria and break them down into different groups, like your Firmicutes to Bacteroidetes ratio. And this is really where we are still in the realm of academics. And it's really unfortunate because some of the companies are making direct-to-consumer marketing claims that you can use microbiota mapping tests to improve your health in various capacities. And that's not true. And it's really unfortunate. And I think the FDA at some point is going to step in and fine these companies, because they're really making fictitious claims. And I don't mean to be a Debbie Downer, but what I see in the clinic is someone spends $400, $500, $600, $700, $800 on one of these tests, and they come to my office thinking that this is going to be helpful, and it's pretty useless. I mean, some people would counter that argument, but I think if you take the most the most honest read of the literature. Well, if you take a literal read on the research literature, there is not one research paper published using a microbiota mapping test to then dictate how to treat a patient.
Yet, I think is probably the best way to say it, because I'm guessing these companies doing similar to what the 23andMe was doing 5 years ago, trying to accumulate data and look for signs and symptoms that they can start putting together.
So I do think we should support something like a Ubiome or an American Gut to amass research, right? But the reason why I take such a hard stance on this is because I've seen so many patients who don't have much money.
Right, spending money on
it's like I barely have enough money to do anything for my health. What's the one straw I can grasp for?
Right. And
they blow $700 on a microbiota mapping test under the promise of it being able to deliver them actionables today.
Right, we don't know what it's going to do. We don't know if it's consistent because we know that the ratios change pretty dramatically, I'm guessing. And tell me if I'm incorrect or correct.
No, you're correct. And there's a whole litany of reasons why the testing isn't quite there yet. And there's a couple tests that are getting close. There's one test out of Norway known as the GA map, and they're starting to show some correlation to IBS and IBD. But even in their research, it's not consistent. There was just a paper published showing that their presumed findings that should correlate to IBS didn't correlate to IBS, but they correlated to obesity for some reason. Whereas two of their previous papers, they were able to show a correlation to IBS and to IBD. And that's the most advanced test, right? The test that's probably the farthest along the road is still working out how to make these correlations. There's also, I believe it's known as day 2, which this microbiota profile can predict glycemic response to foods. So I could see some utility there, but not for improving someone's bloating. Right. That'd more so be for dialing in, I guess, your macros or some of your food choices. And so hopefully we'll get there, but it's been really disheartening to see people who don't have much money, who've put all their eggs into that basket, and then they come in. And I'm like, I'm sorry to break this to you, but this doesn't really tell us much clinically. So I would caution people to be careful with testing, because unfortunately the testing landscape is a little bit tumultuous at the moment. You can get a lot out of a good algorithm, and I say this as a clinician who I have the luxury of ordering 2-3 gut profiles in every patient, and then I've been doing that for the past 8 years. And I can tell you now that I'm testing much less, because there are some things we can test for, but there are also other types of dysbiosis or imbalance in the gut that we know exist, like small intestinal fungal overgrowth, that we can't routinely test for in a clinical setting. So testing only gives us 1/3, I like to say, of the information. We also have to look at the patient's history and then also their symptoms and their presentation and use all that collectively. So you can really get a lot out of a well-crafted algorithm. And I would caution people with the testing. I understand the promise of testing is really sexy. You're told that this will give you the solution.
It's definitive. It sounds definitive.
But unfortunately, it's not. And so if you have a lot of disposable income, go hog wild, right? But if you're in a more financially tight position, I'd be very choosy with the test that you do.
Can you tell me about what leaky gut is, what causes it, and what is the primary concern with it?
So leaky gut, more technically, is known as increased intestinal permeability. The gut membrane is a selectively permeable membrane. We want to let some stuff in, nutrients. We want to keep some stuff out, certain bacteria, certain pathogens. And in the condition of leaky gut, you have essentially too much getting through, right? The barrier has been eroded and worn down. And now instead of having this pristine, selective border, it's almost like, think of like the border at the U.S., right? You want to let people in. You don't want to let criminals in. This, I guess, this is a bad analogy to make at the moment in light of the political landscape, but just putting all those things aside, right. If you have a known criminal with a gun in his hand on the other side of the border, you don't want to let him in. A family, you want to let them in. So in leaky gut, everyone's coming through because the border is no longer working. And there is documentation of this in the research literature. There has been correlation shown. There's a handful of different tests that can be used for this. I don't typically run any leaky gut testing because I presume the healthier someone is, the less leaky their gut is, and the less healthy or the more symptomatic they are, the more leaky their gut is. So I look at leaky gut as a proxy of, or an indirect in an indirect relationship to someone's gut health. So if we can get someone's gut health improved, then we will see their leaky gut improve. And again, the reason why I don't test this, and I'm not sure if this is answering your question or not, but all these tests add up, right? A couple $100 here, a couple $100 there, a couple. So I try to be really cognizant of how much of someone's money we spend, and only spend money on the testing that's going to have a demonstrable impact on the way we treat them.
The path I was kind of leading down is, are there any, I just want to get clarity on what are the known irritants to the gut wall. Is it a bacterial thing?
Okay.
Is it certain things in nutrition that people have to be aware of?
Yeah, sorry, I'm going down the testing avenue here. Okay. I'm having too many functional medicine conversations lately. So there are a number of things that can contribute to leaky gut. Stress is one. Lack of sleep is another. Too much exercise is actually a third. Bacterial overgrowths or fungal overgrowths is yet another. Certain foods, and this is where if people have a grain intolerance, especially a gluten intolerance or a dairy intolerance, or certain foods that they know aggravate them, then those, for the most part, are likely going to contribute to leaky gut. And antibiotics may open the gateway to imbalances in bacteria and fungus that then contribute to leaky gut. Interestingly, at least one, if not two papers, potentially a third, have shown that a low FODMAP diet can reduce leaky gut. And what you see is someone's symptoms get better and their leaky gut gets better, to my earlier point. So for some people, the foods that are contributing to leaky gut are seemingly benign or even healthy foods like asparagus, broccoli, and cauliflower. But if they're in this sensitive state, they may need to reduce those foods in the short term, let their symptoms subside, and that resolution of symptoms typically correlates with a reduction of leaky gut.
Talk to me about intolerances. You brought that word up, and I think that's a word that needs to be clarified for a lot of people. So, you say these foods that people eat are potentially causing leaky gut. Is that so? That's what I heard you say, I believe. Is that the way it works, or is it because they have leaky gut, those foods are now irritants?
Good question. It can go both ways, right? The more, so I'm going to term this, the less healthy your gut, the more sensitive you're going to be to foods, right?
And health determined by diversity of microbes, or health determined by overall inflammatory load, or?
Yeah, you could use a number of measures for assessing it. I would say the easiest thing for a person to, the easiest proxy for a person to employ would just be looking at their symptoms. Right now, you could drill down and try to test different mechanisms that underlie the symptoms, but are you tired after you eat? Do you notice you're having more joint pain than you were historically? Are you not sleeping well? Does your skin not look good? Do you feel bloated? Do you have loose stools? Another great thing you can do is just look at your stools and see, are they super, super small and compacted? Are they really loose and fluffy? Do you see a lot of food particles? All those things are giveaways, or is it kind of like a torpedo, a nice smooth torpedo? Or there's a Bristol stool chart if people want to look it up. And being a type 4 is kind of the optimal in terms of what your stool should look like. But it's just like a sausage. It's nothing, nothing hard to discern there. So there's a number of things that you can look at to know if your gut is moving in the right direction or not. But yes, one of the key things that we want to set as an objective for people is getting them to a point where their gut is healthier and more resilient and able to thrive on a broader array of foods. But sometimes, and I'm really glad you asked this question because it's such a key point, we need to use a more restrictive diet in the short term, heal, and then move to a broader diet in the longer term. What sometimes happens is people do well on a restrictive diet and they stay there forever and they don't ever then broaden their diet out. So we want to use the diets or even things like probiotics in more of a short-term application to heal. And then once someone has healed, and I like to wait 1 to 2 months after someone has hit their peak level of symptomatic improvement to then kind of expand their diet outward. Because that's an important thing to remember, which is just like if you hurt your knee, if you had to go on some kind of stretching, stability, and strengthening protocol post-injury, you wouldn't have to do that protocol forever, right? Eventually you get back to more functional and compound movements. So the same thing with healing your gut. You may do more of a rehab protocol short term, but then longer term, you can get back to your normal exercise or athletics or whatever.
Do you think if someone's under a massive amount of stress, that the type of food matters?
I do. The stress has been shown to flare inflammatory bowel disease and irritable bowel syndrome. And what people may notice is that when they're stressed, they have to be a little bit more careful with their diet, or get a little more sleep, or train a little bit less. Just try to reduce the other sources of stress in their life.
So maybe the question asked a little bit more clearly. If we're trying to fix somebody's gut and we reduce the number of foods they're eating, we eliminate all the common foods, but they're still under a massive amount of stress, will they still be able to heal their gut or still make progress with their gut, or is the stress going to be the overriding factor?
Well, it's certainly not going to help, right? I mean, it's going to function antithetically toward healing, but yeah, I can't say that it would totally thwart someone from being able to heal. And I'm just reflecting on, different cases that we see in the clinic. Some people have life stress that they can't change, right? They have a job that they hate. They're trying to get out of it, but they also have a family to support. So for the time being, they're kind of stuck in that situation. So we try to work more diligently at the other stressors in their life and heal their gut so as to make them more resilient. But optimally, if you could address the stress, whether it be sleep or emotional stress or relationship stress, that's only going to benefit you. And that is significant. There are cases where people have been doing really well, and then they check back in because their symptoms are regressing. And one of the things we always ask about is, what's going on in your life? And there's a fair number of cases where the reply that we'll get is, oh yeah, work has been absolutely nuts for the past 2 months, or me and my partner are arguing all the time. And they're seeing a little bit of resurgence of their gut symptoms when that happens. And I should also mention for people that that's okay, right? Some of that's okay. Sometimes people really kind of get hard on themselves if they notice any kind of regression, but we're all human, right? Just to paint that perspective, if you have a massive amount of stress in your life all of a sudden and you're not feeling quite as well, we're human, and some of that's to be expected. So don't be too hard on yourself. But to your point, to your question, absolutely, stress can have a negative impact on your gut. You can heal in light of that stress, but it would be the most optimal to try to really mitigate that stress as much as possible.
Do you feel that someone can alleviate psychological stress by fixing their gut symptoms?
I think you can make someone more resilient to psychological stress, and there's research showing that you can improve someone's mood with certain gut interventions. There have been 2 meta-analyses, and a meta-analysis is essentially just a summary of the available clinical trials. So it's very high-level scientific evidence. And there have been, I believe, 2 meta-analyses showing that probiotics can aid with depression and anxiety. So
specific strains or just en masse?
En masse, you have the most literature there, again, with your category 1 because they're the most well-studied. But it does seem, at least from what I've been able to discern, that you can probably get there with most probiotics.
Very, very interesting, man. So someone walks into your office and says, I know nothing about probiotics. What are the first 3 things that you tell them? Oh, sorry, nothing about probiotics, but nothing about the microbiome. Right. They want to know about gut health and microbiome. What are those 3 things that are imperative that everybody know and take away from your teaching?
Well, I would say 1 would be learn to listen to your body. That's such a key. And what I mean by this, and a couple examples is, are you may read all the benefits of a ketogenic diet, and now you're thinking, well, wow, I really need to be on a ketogenic diet. So you go on a ketogenic diet, and let's say the ketogenic diet's also really high in vegetables, and you feel terrible. But you keep reading how great a ketogenic diet is, so you keep trying a ketogenic diet. You're not listening to your body, right? You're listening to the blogs and the podcasts and then what have you. Now, you would have been better served if for some reason, let's say you do better on a Mediterranean diet, and you started listening to and reading a bunch of stuff about the Mediterranean diet, you do the Mediterranean diet, and you feel a lot better. So the challenge can be is if the sphere that you're in differs, if the opinion of your sphere differs from what would work for your system. So there's data to support many different approaches dietarily and also supplementally. And I would say listen to your body, because that will help you to navigate what's going to work well
And
for
do you think that's an immediate thing? Like if I change my diet today and I start a Mediterranean diet, how quickly should I feel a difference versus a ketogenic diet? Should I expect to feel better immediately? Because, you talk about ketogenic dieting, you get into a little bit of the physiology behind it, and it's going to take some time to transition into being in a ketogenic state. So people may feel crappy because their body's not used to using fat.
Right.
So how do we discern between, hey man, I just feel crappy because my body doesn't like high fat and high protein diets, versus I just haven't actually adapted to using these nutrients yet?
Yep. I think 2 to 3 weeks is fair. You could make an argument that if you're an athlete really trying to keto adapt for high level athletic performance, that may take months to get there. But for most people who are just changing their diet, especially if you're trying paleo, if you're trying low FODMAP, I think you only need a couple weeks really to get through kind of that gestation, and it shouldn't be too long. And the same thing with supplements. Some probiotics, for example, can cause a little bit of turbulence for the first few days. This is sometimes known as a die-off reaction. So if you have a fungal overgrowth and the probiotic is killing off or helping to rectify that fungal overgrowth, as some of those fungus are dying off and kind of toxins, releasing toxins and exiting your system, you can feel a little bit flu-like, irritable, headachy, tired, but that's a few days to a week tops. So usually the response curve in this, in terms of getting through that adjustment phase, isn't very long. A few days to maybe a week. So I would say one would be learn to listen to your body. The other would be to understand that there's not a magic protocol. And I think people are oftentimes looking for, what's the one, I think I have candida. What's the one best candida protocol? Or what's the one best H. pylori protocol? Or what's the one best SIBO protocol? And I can tell you, as someone who sees patients who've been to a few other doctors, oftentimes, it's not about the magic protocol. It's more about having a process. Having a sound process to work through will help you figure out what protocols work for your gut. And I know that that's not, it's easier for me to say, hey, take this. It's the magic pill that will help you. But a good protocol isn't difficult to follow. I'm sorry, a good process isn't terribly difficult to follow either. It's just you need to have it easily spelled out for you. So don't let the fact that it might be more difficult to follow a process than it is take a product dissuade you from trying the process, because that can really be the difference between success or failure. And what I mean by that, just to give a quick specific, is if you do the right treatments in the wrong order, then that you may not get to where you're trying to be. So if you try a probiotic and it didn't work for you, and then 2 months later you try a low FODMAP diet and it only worked for you a little bit, if you had just inverted the order and you started with low FODMAP, you saw some healing and some progress, and then the final touch was a well-executed probiotic protocol, that difference in sequencing may have gotten you to full resolution of your symptoms.
Can you help us differentiate between a candida symptom or a candida protocol and a microbiome bacterial protocol?
Well, that's another great question, and I think it's all actually fairly similar. I don't think we have to be highly specific in the protocols we use to address things in the microbiota. So whether it be a fungal overgrowth or a yeast overgrowth or a bacterial overgrowth, or even something like a pathogenic protozoa, it's a mistake to think that we can just force this down and force, so we have too much of this and we want less of this and we want more of that. And we can't just custom engineer the levels of hundreds of bacteria and, tens of fungus in our gut. Rather, I think the approach that we should look at this through is that of a gardener, right? We want to try to provide nudges to the ecosystem to inch it along toward optimal balance. And so the protocols that you can use, like an herbal antimicrobial protocol, and I purposefully use the term antimicrobial, meaning it could be antifungal, antibacterial, and antiprotozoal all in the same breath. Though I think the best way to look at that is your ecosystem may be imbalanced, and you can give the ecosystem a nudge with these antimicrobials. And then it kind of it's like shaking the snow globe, right? And then things will resettle, and you're hoping that things will resettle at a healthy equilibrium. But, and this comes back to the sequencing point, if you haven't gotten a good lifestyle foundation underneath that process and the right diet underneath that process, all you're doing is just shaking the snow globe, and it's going right back to its unequal distribution, right? So if you can lay those foundational those steps in the sequence, and then execute a nudge with an antimicrobial protocol, you have a much higher probability that the balance you'll settle back into will be a healthy balance.
Awesome. And I know you're so well versed with the research, so I'll ask this question. How do we know, is there data on how these antimicrobials differentiate between what they're killing in the stomach? Like, antibiotic, we know it's going to kill this strain. Do they have antimicrobials that dialed in to where we can go, we're only going to go in and knock out these particular strains, or is it just kind of going in and bringing down the overall colonization of everything and then allowing your body to kind of regrow in a more proportionate way?
Yeah, it's definitely the later, or the latter of those two. And even with antibiotics, while you do have narrow spectrum versus broad spectrum and systemic acting versus local acting, we still can't say for the most part that we're only going to address these certain bacteria. Rifaximin, as one example, it's a bile soluble antibiotic, meaning that it acts predominantly in the small intestine and it's not absorbed. But even that acts on many different bacteria. The herbals we have less research on in this vein, unfortunately. However, we do have outcome data showing that when we give certain herbs to patients with small intestinal bacterial overgrowth, there's one study by Mullins, who's at Johns Hopkins, who pitted herbal antimicrobials against antibiotics and found about an equivalent outcome. Now, you can make some critiques of the study, but I think overall it illustrated the point that herbals can work about as well. But to your question, what's happening is not highly specific, but rather you're just trying to... So technically, what you're trying to do is provide that little bit of antibacterial stimulus to allow a healthier landscape of bacteria to populate. And the way you can think about this is, if you're unhealthy, that can feed an inflammatory milieu in the gut. And we know that inflammation is a better environment for unhealthy bacteria. So inflammation So in an inflammatory state in the gut, unhealthy bacteria start to flourish, and then they start to kind of bully out the healthier bacteria. So if you can follow a sequence and try to improve your inflammatory status with diet, with lifestyle, with stress, and then give this nudge, what that nudge will do is it'll help kind of kill down some of those bacteria that were overgrowing. And now that you're not in that inflammatory state, the healthier bacteria they're no longer under the foot of the bully, and they can come out and flourish. Makes a lot of sense.
Can you give us your favorite example of a antimicrobial supplement?
Well, if you don't mind me mentioning, because in the book protocol, what I try to do is make it really easy for people. Perfect. So we have it's a 2-month protocol that we use, and we have a series of our biotic clears. So we have a biotic clear 1A and 1B that you pair for the first month, and biotic clear 2A and 2B that you use for the second month. And they're a mixture of various antimicrobial herbs. Oregano is one, berberine, caprylic acid, garlic, and there's many different formulas that can work, but it's more so about using them at the right time, the proper execution, than it is having like the miracle formula per se.
Awesome. Objectively, is there an ideal scenario that we should be striving for as far as these population of bacteria? So getting a little more specific with the question, is it the ideal scenario to eat as diverse food as possible so that we diversify our microbiome? Is it to get outside and expose ourselves to as many different environmental microbes as possible? Like, is that the ideal scenario, or do we know yet what the kind of ideal end result or the ideal microbiome looks like?
It's a great question. I don't think we have that answer fully mapped out, but I think there are some things that we know have a measurable positive health impact on the host, like time in nature. And this has been documented in the literature. It's known as those who live in blue zones and green zones, live near oceans and forests, have a higher life expectancy and lower all-cause mortality.
Sure.
There's very interesting research coming out of Asia with something termed forest bathing, where essentially in these studies, researchers will take two groups of subjects, and half of them will take a walk in nature and half will take a leisurely walk in an urban environment. And it's only those walking in nature who have higher energy, lower depression, lower anxiety.
And there's so many levels to why that would be the case, right?
Exactly.
Yeah.
Exactly. But there's also things that you would think could be health promoting. Like we know that those that grow up on farms have a lower incidence of allergy and atopic dermatitis, two proxies of kind of inflammatory immune status. But if those in their adolescence go and visit farms, it may actually flare their immune system. So there's a nuance here where if you grow up in this more bacterial-rich environment, you have a more well-calibrated immune system. But if you don't grow up in that environment and then you just visit it, your immune system may be saying, holy crap,
too much.
What's all this? Right, exactly. So it may not be that simple of always replicating what works for some populations or some subsets of a population. And that same thing may occur with diet, where a broader diet is probably the best thing to aim for. But if someone has a really sensitive gut and really sensitive immune system, and using inflammatory bowel disease as a good example of this, a diet high in fiber and prebiotics that is sometimes purported as being good because it feeds your microbiome may actually be problematic because it flares the inflammatory bowel disease and it flares their symptoms and it flares inflammation, and then that inflammation can increase the risk of things like colorectal cancer down the line. So there are some basic strokes there that are true, meaning aim for the broadest diet and don't be overly hygienic in your environment. But we also want to be careful not to go to any extremes where we stop listening to our body. Like if every time you go to a farm, you feel like you've really had a flare of your immune system, then,
it's the inverted U scenario like you brought up last night, right?
Yeah,
it's like
exactly.
A little bit is okay, or somewhere in the middle is really, really good, but too much and too little is not going to work.
And then also listening to your body can help you adjudicate, when you've gone too far. Because where that shape of the U distributes along any axis may change from person to person.
Do you have strategies to help people deal and cope with allergies, which we know at some level is influenced by the gut, at some level is influenced by the immune system? Do you have recommended protocols and advice for people who are living with high levels of histamine and allergy situations?
Yes, and this is actually something I think is very exciting. So we know that intestinal bacteria directly produce histamine, and histamine is part of the allergic and seasonal allergy response and any inflammatory response. So we know that intestinal bacteria directly produce histamine, and it's my thinking, I don't think this has fully been bore out yet, but you can draw some inferences to support this statement, that if someone has an overgrowth or an imbalance in their intestinal bacteria, they'll be producing too much histamine. And it's probably for twofold reasons. One, the bacteria themselves produce histamine. Two, if the bacteria are irritating the immune system responds with a histamine response.
Right.
So why does this matter? Because that aggregation of histamine in the system can make you more sensitive to things in your environment. So this is where, and I see this, and there's documentation for this also. The best research documentation is looking at probiotics in those who have seasonal allergies, and there's a number of studies showing benefit there. But also in the clinic, using things like probiotics or antimicrobials or even a low FODMAP diet, which has shown to have the ability to reduce histamine in one study by 8 times, 8-fold. Those can all help contribute to a resolution of histamine and allergy-like symptoms. There's also what's known as a low histamine diet, and this is getting a little bit more advanced and a little bit more for a subset of people who need a little bit deeper of an intervention. But maybe it's just worth a brief mention, which is a low histamine diet also cuts out seemingly healthy foods. Spinach, avocado, any kind of canned food or cured meat, and anything that is fermented like kombucha, sauerkrauts, kimchis are all high in histamine. And especially if you're in this initial healing phase, you may have too much histamine in your system to begin with. So if you're eating a lot of those foods, you can see an exacerbation of some of these symptoms. So for some people, just a short course on reducing their dietary histamine can also help. But in direct answer to your question, yes, you can definitely have a powerful impact on someone's environmental sensitivity through their gut through modulating histamine.
So some of the typical supplements that people throw around when people run into gut issues are probiotics, glutamine, maybe it's aloe vera, maybe it's zinc carnosine. Are those valuable and useful, or is that overstated?
I think probiotics are one of the most beneficial. Glutamine, I think, can also be beneficial. Although for these gut healing nutrients like zinc and aloe and glutamine, I tend not to use those in the majority of cases, because if you fix the underlying provocator of the damage, then you don't really need nutrients to repair the hull of the ship, so to speak. Right? So if you stop navigating your ship in shallow waters and banging in the rocks, you don't need the patch kit as much.
Right. Talk to me about glyphosate. So we know that's massive in our society now, and how much of a role do you believe that's playing in microbiome health, and is it something we could even conceivably avoid?
It's hard to say, because what I wanted to do, and I reached out to a university to see if we could call into some of this data collaboratively, was I wanted to try to do a comparative analysis of rates of celiac, or more importantly, rates of non-celiac gluten sensitivity in Europe versus the US, or in regions with glyphosate use versus non or low glyphosate use, to see if there was and you'd have to control for other variables also, like age and smoking and sex. But if after you're controlling for those other confounding variables, there was an increased prevalence of some of these conditions in areas that use glyphosate, but it appears, at least to my initial inquiry, there wasn't an inadequate data set to really be able to answer that question yet. Speculatively, though, I certainly don't think that glyphosate is helping, and I certainly think opting for organic as much as possible, would be advisable. But it's hard to really definitively answer that question. There may be a few papers on that I've missed. I haven't looked deeply at that in probably 2 years, so there could be some evidence that's emerged since then. But I mean, I wouldn't be inclined to think it's helping anybody, and avoiding it's probably smart to do. I also would be inclined to think that someone would be more impervious to the potential noxiousness of glyphosate as they improve the health of their gut. Because that's the other thing we're always grappling with, right? One is the environment, the other is the host. And let's do everything we can to improve the environment, but we'll never get that perfect. So let's try to get the host as resilient as we can.
So that segues perfectly into my next question. There's people out there who are obligated, I guess, daily to subject their microbiome to things that they don't want to. Maybe it be pharmaceuticals, maybe it be chlorine in their water that they maybe aren't able to get rid of. Is there any daily strategies for mitigation? Like, is taking a probiotic going to be enough to mitigate the negative effects of harmful pharmaceuticals or chlorine or whatever it is that's destroying their gut?
That's a great question. I don't mean to keep coming back to kind of a more basic answer to a specific question.
That's great.
But there's a lot that you can do to improve the health of your microbiota that doesn't necessarily even require direct supplements. Supplements may be helpful, but the simple way I guess I would answer this, then I'll fill in with a few justifications, would be find the couple interventions from working through a sound process that gets you feeling the best, and stick to that, because that's going to likely keep you with the healthiest balance in your microbiome. Now, that may differ from person to person, right? So some people may do great on probiotics. Other people may notice that probiotics tend to bloat them, but they did really well on a low FODMAP diet. So that's why there's not necessarily one blanket statement that we can say would work for everyone, but rather trying to find what works for your gut, meaning what gets your gut feeling the most resilient and the most devoid of symptoms. Now, at the same time, it's also maybe important just to showcase that there is a measurable positive impact on the microbiota from things like exercise. we know that sedentary people have less diverse and what we think is less healthy microbiotas. And then when they start exercising, they have more diverse microbiotas. And we know that cardiorespiratory fitness predicts the health of the microbiota. So while the supplements can be helpful, and they can be used as part of this strategic process to give you the healthiest gut that's possible, I would say start with those foundational factors. That may be enough, and then only use any additional supplements if you feel like they're actively improving your symptoms.
So for someone who's lacking in serotonin, maybe living with anxiety or something like that, other than the basic intervention that you mentioned dietarily, are there any supplements or strategic things that you like to introduce to the diet to help alleviate low levels of serotonin and high anxiety?
Well, that's an interesting question, because the serotonin theory of depression has partially come under question of late, and I am not an expert on this, but I string this together with another lab that was doing urinary neurotransmitter analysis, and a lot of practitioners in the functional medicine community were using this. And then about 2 years ago, that lab pled guilty to fraudulence, and they were actually not following CLIA, which is the clinical laboratory police, for lack of a better term. And they were actually manipulating the lab ranges and in attempts to make people look like they needed supplements when they didn't need supplements.
That's shady.
It is shady. And so, unfortunately, you have to be a little bit careful. And so I think that was another area of promise that was later found maybe not to really deliver. For serotonin, we do know, and there's a researcher named Michael Mays who has been showing that when people are inflamed, they are more prone to divert their precursor amino acids down inflammatory pathways. And there's this pathway known as the kinanurinase pathway, where you will divert your, I believe it's more so tyrosine than it is serotonin precursors. But I may be a bit skewed here, but you essentially have your dopamine precursors and your serotonin precursors, and these are the prominent dictators, at least some of the theories purport, for your brain chemistry, so your mood and your focus. And the take home is that when you're inflamed, instead of making serotonin and dopamine, you make these inflammatory compounds.
Yep.
And so the way to resurrect healthier serotonin production in the brain may be decreasing inflammation. Now, in the gut, Torek Mazalwi, who is a gastroenterologist in Norway, the research group he's affiliated with has actually shown in the gut a low FODMAP diet can increase the serotonin cell density in those with IBS and make it more like that of healthy controls. So serotonin in the gut may be fixed by going on a low FODMAP diet. And then we could argue that serotonin in the brain, the best way to resurrect that may be by reducing any inflammatory insult on the body.
So as I sit here and drink my Brew Doctor kombucha, the number of people out there consuming these fermented foods is huge. And you hear conflicting opinions as to whether it actually has any value and implication. Any theory on that?
Yeah, there's definitely research showing various probiotic products, whether it be something like a kefir or a fermented milk or a different kind of probiotic drink of whatever sort. There's definitely a handful of studies showing that these probiotic foods can help with, mainly you see these studied in a model of IBS, because that's going to be one of the most direct corollaries to impact. But there's definitely way more data on probiotic supplements. Whether that's good or bad is that's another conversation. But yeah, there's research showing that these foods can help, and I would recommend people try to incorporate either probiotic drinks like kombuchas or things like sauerkraut, kimchi, kefir, if they're not dairy sensitive, or find a non-dairy kefir if they are, into their diet, with the one caveat that if someone's really histamine sensitive, they may have to be a little bit careful with those at the start. But there's also a real ray of hope for people who are histamine sensitive, which is, if you look at your fingers are like the villi, the little the little tips of your intestines, and these villi secrete enzymes that digest histamine. So it has been shown, and I do see clinically, that when you improve the gut health in an individual, their ability to digest histamine and therefore tolerate histamine improves. So there's a lot of hope at the end of the gut healing tunnel, meaning that as you heal, you should be less intolerant to FODMAPs, less intolerant to certain grains, less intolerant to dairy, less intolerant to histamine. And so one of the things that can be useful as part of that process could be some kind of, like a Brew Doctor kombucha or any kombucha or sauerkraut or kimchi or whatever it is.
Amazing. Tell me the name of your book again, Mike.
Healthy Gut, Healthy You.
I love it. So for any of our listeners out there who go over to iTunes now, leave us a review, and tell us how awesome Dr. Mike Ruscio is on the Muscle Expert podcasts. I'm going to send you one of his books. I'm going to pick 2 people, leave us a review. I'm going to send you his book, and if he's nice enough, he'll sign it for you.
For sure.
Thanks, man. Dude, you're awesome.
Thank you. It's been a lot of fun.
That was awesome, guys. And, in summary, there's a lot you can do for your gut, and it all starts with an intelligent approach to nutrition, potentially considering doing some fasting, so it's not just stacking food on top of food, eliminating stress, maximizing sleep, and then somewhere down the road, read Dr. Mike's book to learn how to apply all of his amazing protocols to your health and living your greatest life. Enjoy the day.
Join us on benpakulski.com to learn the cutting-edge techniques to take control of your body, your brain, and create your greatest life.
This podcast is for information purposes only. The statements and views on this podcast are not medical advice. This podcast, including Ben Pakulski and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements or advertisements for products or services. Individual